Episode management is a continuous proactive episode review process where we look to demonstrate pursuit of Medicare's triple aim to improve the patient experience of care, improve clinical outcomes, and decrease the per capita cost of healthcare. In other words, episode management is a method to ensure that we're providing the most efficient, effective quality care to our patients. Some of the changes that have occurred that have really heightened the importance of episode management to providers are this concept of patient-centered care, which has been growing over the past several years and was really reinforced by the revised conditions of participation, which became effective in January of 2018. And in addition to that, we have the home health value-based purchasing demonstration, which began in 2016, where providers are receiving either financial rewards or penalties depending on how they perform based on certain clinical aspects as well as patient satisfaction outcomes. And on top of all of that, we have this impending change to the payment model, the patient-driven groupings model, which kind of reinforces again that whole idea of patient-centered care. The three key clinical factors that agencies should prioritize as a part of quality episode management include development of episode management protocols, education on patient self-management support, and quality and reduction of hospitalizations. Providers should prioritize as a part of quality episode management should include first the development, implementation, and reinforcement of episode management protocols. Those protocols should include things like best practices, secondary discipline triggers, clinical manager oversight. Part of that should also include clinician education on the protocols that are developed. Agencies should also focus on industry-wide clinical best practices to ensure efficient, effective quality care is being provided to their patients. Another key clinical area that agencies should prioritize is education on patient self-management support, otherwise known as integrated chronic care management. This is a strategy that ensures the patient is thought of as the expert in their care and helps to foster a sense of trust between the patient and the caregiver, which then helps us to achieve patient goals easier and also improve management of the patient's chronic disease. Lastly, education on quality of care, including reduction of rehospitalization, should remain at the forefront. Medicare's focus on rehospitalization as a key quality indicator has remained unwavering since 2013, when hospitals began to receive penalties for rehospitalization and Home Health Compare began to publish claims-based hospitalization rates. This has only been reinforced by value-based purchasing, as this is one of the measures that providers are receiving financial reward or penalties for.